All right, welcome everyone. This is Keenan from Keen Speaks. Today or recently, there was a pretty eye-opening exposure brought up by, now there have been many, I admit, but this one was extremely eye-opening because it hits on a subject that is integral to our survival as a species. And it's really kind of terrifying because it affects fertility in both male and females. Now, not only is this video damning and damaging to the rhetoric that we have dealt with over the past couple of years, but it's extremely frightening when it comes to the fact there comes to the potential damage that it may have caused to our ability to propagate as a species, at least for this current subsect of generations that are alive today. Let's watch. This is Dr. Kim Bliss, an OBGYN from Florida State, speaking with a representative from independent journalism. I'm not exactly sure where the reporter used to have affiliations with, but I appreciate everything that you put forward in this video. Let's give it a watch.
Very admirable. I know it's not easy. So if you could just give yourself a little quick introduction, who you are, what you do.
Sure. Well, thank you so much for having me on your show. My name is Kimberly Biss. I'm a board certified OBGYN in private practice in the Tampa Bay area of Florida. I graduated residency in 1998, and I've been in private practice in the same town ever since. So I've been doing this for quite a while. And I'm the chief of staff of my hospital, which is a 400-bed level 2 trauma center. We also have high risk obstetrics.
And these are the
and
people
we pretty
that
much
were
represent
silenced.
all medical fields. Very rarely have to send a patient to another hospital for treatment. And I've been the chief of staff since right before the pandemic started. So it's been a crazy ride. But I'm speaking out now because I've noticed back, I want to say around November of 2021, that we were definitely seeing pretty significant increase in our miscarriage rates. And so I started doing a deep dive into my data, keeping track of those. Also noticed less new OB registered patients, which would maybe be a reflection on infertility around the same time. The shots rolled around in Florida, the beginning of 2021, but most people started getting the injections in April of that year.
Right.
And I was kind of under the radar for quite a bit, but I went to an FLCCC conference in October of 2022. And I got early to the conference hall Saturday morning, and Steve Kirsch was sitting by himself trying to enjoy his breakfast, and I wasn't going to allow that. So I went over to introduce myself, and he found out I was in
Steve Kirsch, Thorpe, Peter McCullough. There's so many others, but Robert Malone was one of them, obviously. Eli, I can't remember his last name. Either way, there's so many doctors and experts and professionals that were silenced during this turbulent time, and it's really eye-opening when you actually listen. Not with your feelings. Listen to what they have to say and the warnings they tried to put forth. You really start to understand how broken the rhetoric, the direction of the rhetoric was. And it really becomes frightening once you start to see it for what it really is.
OBGYN and immediately wanted to do a video and asked me about some of my statistics. And I met Dr. James Thorpe at that
Yeah.
conference. And then a week later, I'm being interviewed by Peter McCullough. And so I'm hanging with some pretty prominent people and just trying to get the word out that these shots need to be stopped and they never should have been given
Thank
to
you.
anybody, but especially pregnant women.
Thank you. Thank you so much. I know this takes immense courage and bravery. So I just thank you from the bottom of my heart for doing what you're doing. I know it's not easy. We've seen what happens to doctors when they come forward with the truth. And what you're doing is for humanity. So God bless you. So what have you seen that has been alarming to you in your practice?
So, the normal, what's
death.
quoted in the literature and the textbooks for
Murder of
miscarriage rates is
crows.
about 10 to 15%. But Dr. Thorpe will argue that the literature really is not correct, and the average miscarriage rate is about 5 or 6%. My miscarriage rate in the year 2020, when the pandemic started, was 4% from month to month. I actually sent all my data to Jessica Rose, and she did a Substack on that back in November of 2022 and put all my numbers into nice little graphs, etc. But in 2020, my miscarriage rate was 4% on average from month to month. And then in 2021, it doubled to 8%. And in 2022, it doubled again to 15% was the average. And I gave her my data up to November of 2022. And then in December, the miscarriage rate in my practice was 25%.
Oh my God.
We had 40 newly registered, first trimester pregnant moms, and 13% ended up miscarrying.
Wow.
Yeah.
This is so alarming.
Yeah, and at the
13
same time,
fucking
the number
percent.
of initial, newly registered patients, like 40 new patients in December of last year. That's the most we've ever registered, but we were seeing a huge downward trend in the number of people registering in our practice from, year to year. 2020 was actually our best year, and that should have been the worst, right? Because that's when
Right.
everybody was getting the initial viral infection.
So
Before
you're
the
not
vaccines.
seeing women getting pregnant as much as you used to.
Correct.
Okay.
And I have had a few patients that have been my patients for quite some time. We've delivered their babies, and now all of a sudden they're having a hard time getting pregnant, and they're having to see fertility specialists. And I will tell you, I'll get 5- and 6-page
How do you
reports
not
from
see
these
the
fertility
connection?
doctors, and not one mention
This hurts my
The vaccine.
brain.
vaccine had anything to do with it.
This kind of
And
information hurts my freaking brain,
your
man.
professional opinion is that it is the vaccine.
Well, I mean, it was given globally, and globally, we're seeing these issues. The birth rate is down around the world, and I don't think that's because of climate change concerns
Oh, or gas stoves.
or gas stoves.
Oh dear. And very scary and alarming numbers. Yeah, very, very scary. In terms of the menstrual cycles, have you had a lot of women? I've been contacted by so many women. I've interviewed a woman who had severe clotting, which she never had issues until after she was jabbed. Are you seeing this as well?
We are. I'm actually involved. We're newly in the development stages of this study, but Dr. Thorpe, Dr. Dan McDyer, myself, Dr. Ryan Cole, we're going to be looking at actual tissue samples in people who have had either DNCs or hysterectomies for abnormal bleeding, Dr. Cole can do tissue stains and determine whether or not there's spike protein in these tissue samples. And then he can also take it a step further. If there isn't any nucleocapsid protein as well, that rules out the possibility of the spike being there because the patient had a COVID infection.
I got
good.
excited while I was trying
Spike by
to
itself,
post this.
then it's from the vaccine. And if the patient wasn't vaccinated, then we now have proven that there is shedding.
Wow. But
Fauci said that's not possible. It stays in your arm.
Between COVID, the vaccine, and even shedding.
Correct. Because if the patient has spike and she's never had an infection or an injection,
right,
and the only possible way it could be there is by shedding. And
shedding,
a year back,
that's the term. The
only
only
the one who has the My Cycle story
possible argument when things started to come out was that it was going to be isolated to the location,
vaccinated, but they had
or that it wasn't going to drift, or that it wasn't going to shed. And now there's evidence of it shedding, even in the placenta.
We can
it's transferring through generations,
that's
through
quite frightening.
Through the one
and yeah, I've spoken to a couple
connection between mother and child
who test blood, and they are saying that they're seeing graphene oxide in the blood of the unvaccinated, which confirms this shedding theory. Not one I ever really wanted to. I'm not here to scare people. I'm here to make people aware so that they can take the proper steps to protect themselves. I want to talk to you about
you should
the
be
babies,
scared.
though, and
you should be scared.
I know you had mentioned, and I know that there's patient doctor confidentiality,
systematically attacking future generations
you had
through experimental gene therapy
in the umbilical cord.
Yeah, she was about 26 weeks along and was not feeling fetal movement, came to the hospital, and we diagnosed an intrauterine demise. And when I delivered the baby, there was pretty significant blood clot in the umbilical cord. She had a booster within a few weeks of that delivery. So I'm pretty convinced that was the culprit behind the situation because she otherwise didn't have any risk factors to have a stillborn. I will tell you, in our area, thank God, we're not seeing the numbers that Dr. Thorpe has published in some other areas of our country. And I know there's several areas in Canada.
Not yet.
Where he's had some whistleblowers come out. And Scotland appears to be they've had a huge increase in their stillborn rate too. I've not seen.
Keep in mind, while all of this is happening, there are reports and studies coming out not only about masks, but about lockdowns and about COVID protocols and about social distancing and about massive increases in sudden death and unexplained deaths that are being reported across the globe. We have Australia, we have UK, we have Sweden, we have, if I'm not mistaken, Italy. Yeah, they're all over the place, and they're there for you to see, and no one is really paying attention to them because the mainstream media likes to curtail everything that is used to motivate the masses.
In that, I actually pulled the numbers from our floor for the last few years, and our stillbirth rate's been pretty steady from year to year. So
And do you chalk that up to the fact that Florida is not heavily vaccinated state?
Well, we're not 90% like California and New York probably are. I think even the state of Vermont may even be more than that, but I say we're pretty close to 70%. 65 to 70% of Floridians at least had the first 2 injections, and then the percentages started to drop off with the latter 3 shots.
Right. Are you seeing the numbers here in Canada? Like British Columbia is a very, and I don't want to, this isn't political at all, but it seems like the Liberals, really got to people, and we're seeing the Liberal states which are more vaccinated. Is it British Columbia or Ontario in Canada that you're seeing the numbers, or is it kind of Canada wide?
So I don't remember what Dr. Thorpe said, but there were a couple places in Canada that he had mentioned the towns of, but I'm not sure which province they were in. But I will
Okay.
tell you, in our country, it's very similar with regards to, vaccination, mask mandates, and lockdowns. A lot higher rates, and lockdowns lasted longer than, the red states, so to speak.
Yeah.
I'm fortunate to be in Florida because our governor, Ron DeSantis, is very
God bless
uh,
him.
intelligent, let's say, and listen to the correct
Sometimes I
scientists
wonder if it's
and
time to
not to
leave
Fauci.
BC. As much as I love this
He
province.
opened us up pretty early on, got rid of masks very early on, and
Yeah.
he is not going to allow any mandates. But the problem is we don't have any laws on the books for that. So I'm actually going to our state capitol on Tuesday. We're going to have a rally in the Capitol to support a bill we're trying to get passed that's going to eliminate any mandating of any treatment, pretty much.
God bless you. God bless you. I saw that Idaho just passed a bill, or is trying to pass a bill that would make it a misdemeanor. And I spoken to Carla DiPaolo. She works
How bad is it? How bad is it that states are actually banning unvaccinated, or sorry, banning vaccinated blood donations? If that doesn't tell you something, then I don't know what will. Like, you just need to open your mind a little bit, do a little bit of your own personal research, and you will, unfortunately, you'll tumble into an absolute abyss of information. And I don't mean abyss in the fact that you'll get lost. I mean that the wealth of information supporting some of this is astronomical. And most of it has been censored or suppressed for the past 3 years in the interest of profit. Profit. That's the only thing they care about. They don't care about your health. They care about the money and the power and control that they garner through fear. Wake the fuck up.
During the AIDS crisis, and she's like the national pediatrics aid representative for the US. And we talked about this, and she's like, I don't even think it should be a misdemeanor. It should be a felony.
Wow.
Yeah, it should be a felony. So things are happening in the US.
Damn right it should be.
Canadians hope.
Beyond
Your
felony.
system seems to be better
If
than
there
ours.
is such a thing.
And thank you so much for
It should be
doing that.
prosecuted
I know
to the highest extent
this is
of
not
the law.
easy, but God bless you. It is
I
crazy.
understand why she's tearing
so
up.
you did say that typically you'd see about one stillborn a month, and now
Because
the numbers
it's
are
absolutely
about 20
sickening.
a month. Is that accurate, or that was Dr.
So
Thorpe that said that?
Michelle Gershwin is his whistleblower. She's a nurse out of Fresno, California.
Okay.
And she definitely, once the shots started rolling out in California, she noticed that their number of demises on the board increased quite a bit, to where it was an average of 20 a month. Now they deliver, their hospital system delivers about 8,000 babies a year. So to have 20 a month, it's a pretty
terrifying.
big number, because the rate of stillbirth is about 5. I'm sorry, it's about 1 to 2 out of 1,000 births. So that is a pretty significant increase. Normally it would be 1 every month or every other month.
Okay. Very admirable. I know it's not easy. So if you could just give yourself a little quick introduction, who you are, what you do.
If that doesn't really show you just how broken the mainstream media and the government and the corruption and the corporate corruption and manipulation that has been propagated across the globe in the past 3 years, I'm not sure what to say to you. This is terrifying. They're affecting the fertility rate of many generations for years to come. And we don't even know the full extent of this yet. Like, we have no clue. It's literally going to come and smack us in the face. And my fear is that by that time it'll be too late. Anyways, I am sorry to have to share this warning, but in the interest of my future and my friends and my family, who have all bent the knee to this corporate facade, I think it's time Keenan speaks. My name's Keenan. Thank you very much for your time. Go check out, the profiles and information of OBGYN, Dr. Kim Bliss. And definitely on Instagram, at least while the video is still up, go check out independent_journalism_2. Because the fact that they are actually able to repost this and keep this up is so important to communicating these flaws and the broken rhetoric. Keep up the good work. And once again, this has been Keenan from Keen Speaks. Have a great night.